this working? Good. All right.
You ready?
No, but I'll try.
Okay. All right, we're starting now.
Okay. My name is Sam Ferguson. Normally, I do math at the Cron Institute, and today I'm talking to you all about how to help find Affordable Care Act subsidies for self-employed friends. So how many of you have a self-employed friend? Could be an Uber driver, could be a private tutor, could be a senior citizen who has an antique business, could be almost anybody. But many of these individuals have lower incomes and they qualify for Affordable Care Act subsidies to help them pay for health insurance. So today we're not going to learn how to compute the actual subsidy in complete detail. Instead, you're going to learn how to help advise a confused friend on the method to compute the subsidy. Okay? All right. There will be percentages, so you need to remember things like 9% of something is 0.09 times that thing. So 9% of $100 would be $9. All right. So basically, the subsidy is going to be the cost of a certain benchmark insurance, which your friend will know about, minus what they are expected to contribute. So the cost can be looked up, but the expected part may not be known to your friend. So we must pursue that. Okay, and this is a quick example. If the cost is $5,000 for the whole year together, and the expected contribution is $4,000, then their subsidy would be $1,000, the difference between those two. Okay, so how to find the contribution? Well, for certain individuals in 2017, it was 9.69% of modified income. So this raises some questions like, what about other individuals and what is modified income? So I've created a little sheet. You won't use the whole sheet, just the upper right portion of this sheet. You can ignore most of the sheet. Okay? Okay. You can get out a cell phone that has a calculator app if you wish. Okay? So at the upper right, you can see a dollar amount, which is that person's earned income. And below that is a dollar amount, which is the cost of the benchmark plan for New York City for this year, this past year, which was the Fidelis Care Silver Plan. Okay? And you can take the first number minus the second number to find your friend's modified income. And if you get confused, the answers are on the back of your page. Okay. Great. Okay. So the assumptions for this are that your friend is single, no dependents, and their income falls in a certain range. Okay? These assumptions are very technical, but your friend will know where their income is, so they'll know what range they're in. Okay, but for larger incomes, larger than this rightmost number, they do not receive a subsidy. So they better know which band they're in. And if they're confused, you can help them out. You can ask them, well, what's the upper end of the band? Are you above or below that? If they're below it, they will qualify for a subsidy. Okay, so here's an example. Modified income, $40,000. The contribution is 4 times the 9.69 thing, which becomes $969. And if you multiply 4 by that, you get this contribution. Okay? But if they were $1 beyond this upper threshold, boom, they get no subsidy. And so their contribution is the full cost. Okay? All right. But now there's a problem that the true answer that they are supposed to find, their modified income, is actually supposed to be, for self-employed people, their earned income minus the net health insurance cost. So the number we computed was just more like a rough guess. Okay? The true number is going to depend on the net health insurance cost, which is the cost minus the subsidy. So you can see, this is an unsolved mathematics problem. For the past 3 years, no government agency and no tax software has been able to consistently and accurately give subsidies for self-employed people. Because at the beginning you want the subsidy, and at the end you need the subsidy. Okay? For very simple tax returns, you can often guess and check and get the right answer, but for complicated returns, it cannot be found. And so now the IRS has proposed a procedure for trying to get closer to the right answer, which is now done by looking at the next couple of lines of the upper right of your sheet. Okay, so if you look, you can find in the upper right the expected contribution from that income you found before. So you can multiply 0.0969 times that modified income. And that's their expected contribution. So you can either compute it with a calculator or look on the back of the sheet if you want to save time. But then from that new expected contribution, you get a guess for the subsidy in the following line. Then from that guess from the subsidy, you can get an estimate of the net insurance cost in the line below. So you would take this number minus that number and get a number. Yep. So great, you're already there. So then your net insurance cost would be the premium, this number, minus the subsidy. So this number minus this number would be going here. You're welcome to shoot. Good. So keep going down. So then their expected contribution becomes a new number. And they end up getting a second try at the subsidy. Okay. Excellent. Good. So now you find this number times this number if it's bigger than this. Otherwise, use write not. Okay, and if it's not, the subsidy is $0. Okay. So their earned income minus the subsidy goes.
Okay.
Yeah, right. Great. And so basically, we end up with a second value for the subsidy, which is different from the first value, is the point of all this. So you all just need to fill in a couple more blanks. Thank you. Okay. So what we find is that for arenas, you can plug the new subsidy back in, find a new net cost, and proceed until you get a closer and closer answer. But for the other two of you, that doesn't work. You end up with a zero subsidy, which puts you back where you started, and you get into an endless loop, going over and over again, never getting the actual subsidy amount. And this is why I have developed a new method, which will allow 100,000 families this year to get health insurance. So the IRS method continually plugs in, but near certain amounts it fails. Then the IRS will allow any method because their method does not work. And I've developed a new algebra method, but it's complicated with many formulas. I don't like it. Square roots appear. And I have a new halving method, which does work. If the subsidy is too big, you average it with the previous too small subsidy and proceed. If the subsidy is too small, average it with the previous too big subsidy and proceed. And then, after a few steps, it will give you the correct subsidy. So, how do you help your self-employed friend? The answer is, if the second modified income falls on the other side of the subsidy cliff from the first one, the IRS method will not work. And you can advise your friend to use a subsidy calculator, which will be posted on my Quant website. Okay, thank you very much for attending my talk. Please spread the word if you have any self-employed friends who want health insurance. Thank you.
You still have 50 seconds if they want to ask any
Okay.
questions.
Do you all have any questions about this? So I realize it's a new procedure that's just been developed over the past couple of days. So it's cutting edge. But you're welcome to ask any questions you like.
Yeah, is Quran hosting the site?
So Quran hosts my student website.
Yeah.
And the calculator is currently, a Google engineer is working on it, but after he's done with it, then it will be posted on my website. So my website's down. It doesn't exist
Right,
currently
right,
because
right,
it's down for maintenance.
Yeah.
But when it's up for maintenance,
Then
then
you'll
it will
have the
be
calculator.
accessible through
That's
link.
amazing.
Yes.
It just seems like this is a government thing, and this is like too basic a problem. Like, how did nobody realize that there was this?
No, the problem has been known for more than 3 years. It just was unsolved.
Oh, I see. Okay.
Great.
Thank you.
Thank you.
Right.